The weather, the atmosphere, and simply the lifestyle of Miami is what captures Selena Wolf's heart.
It's great. You can be outside every day. You know, the weather's so nice. So yeah, no, it's great. I love that about it.
Perfect weather, especially for an avid runner. But about 6 months ago, Selena started noticing that she could not keep up with her mileage. After every workout, her feet would be downright painful. It even started affecting her work.
Very painful standing for a long time.
I was going to say, what did you do for work? Because you said you stood.
I worked in retail, and so I stood all day. At lunchtime, you know, I just could not wait to sit down. My feet hurt so bad. Well, my husband bought every kind of little gadget that he saw on television or at the drugstore that was supposedly going to fix bunions. And so the toe separators, the stretchers, but they were painful. They didn't work.
That's when Selena decided to turn to a foot specialist to help her beat her battle against bunions. She turned to Dr. Jacqueline Burrell, who is the residency director of the Podiatric Medicine and Surgery program at Miami's Mount Sinai Medical Center.
It's one of the most common deformities that we see as foot and ankle specialists or as podiatrists. These are actual x-rays of Selena's feet. The deformity that you can see on the right was definitely more significant than on the left foot. You can see that the first metatarsal joint begins to sort of deviate towards the midline of the body, and it creates that bump that we all call a bunion, the migration of the bones to sort of keep the center of gravity because of this mechanical misalignment, if you will, that's occurring at that big toe joint. And unfortunately, it's progressive with time, so it's going to get worse. It's also going to get worse based on the mechanical demand that that particular patient puts on that foot. And with her running and being very active, unfortunately, I think this deformity progressed pretty quickly.
And Selena's foot deformity was getting more painful and debilitating because of the arthritis that was developing in her big toe joints due to this malalignment. She admits she was always self-conscious about her feet.
My bunions are hereditary. You know, they're genetic. I've always had them as long as I can remember. I've always thought that I had ugly feet. You know, you see other people with cute little feet. You know, I never had cute little feet. So I always had a problem wearing shoes. You know, I've worn sneakers most of my life. I usually, because it's the most comfortable thing. Any shoe that was very fitted, you know, ballet flats, you know, any kind of heel I couldn't wear. Anything that put pressure on my toes, I couldn't wear.
Recent studies show that 55% of American women have bunions. Matter of fact, bunions are 9 times more common in women than in men.
There are several causes for the development of bunion deformities. Most common cause being genetics, and patients actually inheriting a biomechanical fault that causes the bunion to develop with time. There can be other causes as well, traumatic events that can cause a misalignment of the joint, as well as ill-fitting shoes can actually aggravate the bunion deformity and cause it to progress more quickly.
Wanting to pursue her passion for running and just to be able to walk and stand comfortably for a period of time, Selena made the decision to have bunion surgery. Check out her before x-rays.
Surgically, what we did for Selena was actually cut the first metatarsal bone, realign it, and create a straighter first metatarsal phalangeal joint or great toe joint.
And here are her post-op films. Selena was so pleased with the results, she shared with us these photos. The before and after is amazing.
But it was great, and my feet are, you know, it's so much more comfortable running now. I don't have the knee pain that I had before. No, it's great. It was really weird though, learning. I felt like I had to learn to walk again after having both feet done, because you have to wear those shoes and walk very slowly and very carefully. But now it's great. I'm glad I did it.
Although there are many benefits of bunion surgery, it is surgery, so there are some potential risks. For instance, infection, scarring, and prolonged swelling. One of the most common things people want to know, when can I get back on my feet after surgery?
The average bunion in the middle-aged patient, they are walking immediately after the surgery. Same day, they're walking out of the operating room. They're usually off their feet for a good, or I should say, relaxing, taking it easy at home for 3 or 4 days, and then they can slowly, gradually begin their normal routine. Of course, their foot isn't going to fit into a regular shoe right away during the healing process. As long as the incision is still healing, they're going to be in a post-operative shoe after the incision heals, and I really encourage them to get back into a sneaker or some sort of an accommodative shoe rather quickly. Most patients are at that point usually at about 2 weeks after the surgery. Another 2 weeks for the swelling to come down and for them to sort of not have as much pain than they were having originally after the surgery. So I would say a total recovery time, getting back into their regular shoes and doing their regular activities, it's a good 2 or 3 months. And that's because, you know, we're walking on that surgical area that we did. If we did the same procedure on a patient's hand, the recovery would be a lot quicker. But because we're walking, and it creates stress with each and every step, you know, it takes longer to heal. But it's not a painful recovery. It's just swelling and some discomfort.
Since Selena's husband had some time off from work to take care of her, she decided to have both her bunions taken care of at the same time.
Selena was sort of a strange case because we did both of her feet at the same time. Usually I like to do one foot and wait for it to heal and then go back to the other foot at a later date so that she has one good foot to stand on per se, you know, after the original surgery. But she really wanted to get it done at the same time. She had a couple weeks off from work, so that's what we did with her, and we did both, and she had a good result, and I think she was back to work rather quickly.
People live with chronic pain every day because they feel like they have to, but you don't have to. It can be better.
And even though Selena did not have surgery just for the sake of being able to wear stylish shoes,
Wow.
So yeah, they're cute.
she admits it has been a nice bonus.
It's a nice bonus. I can wear shoes that I couldn't wear before, but even then I don't abuse my feet.
Well, I don't think we should show those to Dr. Brill.
She won't like those. She would not be happy about these. You gotta take care of your feet. You walk on them every day. You have to use them. Yeah, life is good. It's better now.